Hello there. Welcome to Pathology Case discussion. I'm Dr. Alekh Verma and today's case is a 22-year male presents with fracture of the lower end of femur. On X-ray examination, you also find an osteolytic circumscribed mass within the epiphysis of the bone. The histopathology of the lesion is given below. Which of the following statements is false about the tumor in discussion? Option A, it is commonly benign but locally aggressive. B is osteoclastic giant cells form the neoplastic component. C, metastasis to the lung can occur. And D, the treatment is by curettage. I'll give you 15 seconds to answer the question and your time starts now. So I hope most of you have attempted the question right and I'll tell you the answer later. But before, let's see how to approach this question and what other clues were there in the question given. So the first clue I'll catch is that the tumor is arising from the epiphysis. If I remember the classification of tumors via the site of origin, I can think of three tumors that arises from the epiphysis, that is giant cell tumor or osteoclastoma, chondroblastoma and clear cell chondrosarcoma. The next finding I can see evidently is the presence of large number of osteoclast-like giant cells in abundance. A giant cell is one which is giant in size and it has multiple nuclei sharing a common cytoplasm. There are many physiological and pathological giant cells which I'll discuss later. An osteoclast-like giant cell is identified by the presence of 100 or more nuclei. And if you see the presence of these giant cells in abundance one after the other in an epiphyseal osteolytic lesion, the diagnosis points towards osteoclastoma or giant cell tumor. I said point and not indicative because giant cells are also seen in many other conditions like aneurysmal bone cysts, brown tumors, reparative granulomas, osteosarcomas and many other conditions which should be excluded by radiology, clinical history and other histological features. But there is another component to the osteoclastoma, and that is the presence of mononuclear stromal cells as pointed out by the blue arrows. These mononuclear cells are uniform and oval, having a nucleoli, and in fact these are the ones which form the neoplastic component of the giant cell tumor or osteoclastomas. The question above asked which of the following statement is false about the tumor in discussion. Now when you know that this is a case of osteoclastoma, let's discuss its other important features and rule out the options one by one. Osteoclastomas are in fact benign tumors and also circumscribed, but sometimes they can cause local destruction and therefore option A is correct. Though a benign tumor, there are case reports that they show that they can metastasize to the lungs, the incidence being around 4%. Therefore, option C is also a correct statement. The good news is that the treatment is generally done by curettage of the lesion and does not require chemotherapy or amputation as in other aggressive bone tumors like osteosarcoma or Ewing sarcoma. Therefore, option D also appears to be a correct statement. And as mentioned before, that it's the mononuclear stromal cells that are the neoplastic component and not the osteoclastic giant cells. Therefore, answer for this question and the false statement is option B. Hope you like the discussion. That's it for now. Do like the video, comment and yes, don't forget to subscribe. Thanks a lot. Have a good day.